Michelle Maneevese. Welcome to another episode of Alate Health Presents. Joining me today is my partner, Dr. Andrew Doe.
Thank you, Dr. Maneevese. I'm Dr. Andrew Doe, a vascular interventional radiologist at Alate Health, and we'd like to start by recapping our topics for the past couple weeks. Dr. Maneevese?
The first week, we started off with one of my favorite topics, uterine fibroids, and how interventional radiology and us here at Alate Health can help with minimally invasive techniques to treat these fibroids. What did we talk about the next week?
So we talked about prostate artery embolization, a very similar treatment, but for a man and their enlarged prostate. And we also offer this at Alate Health, and it's, again, minimally invasive.
And we finished off with, just last week, venous ablation, how to help those achy, heavy, purple-looking legs, and how to get our patients back on their feet and walking again.
Yes, and this week, we're going to kind of follow up on that topic, and we're going to look at the other side of your circulation, as many people call it, and that would be peripheral arterial disease.
Yes, Dr. Doe, and peripheral arterial disease is something that affects 8 million Americans every year, contributing to 50,000 deaths and $400 billion in Medicare costs.
Yes, and these are staggering numbers. And in today's world, we have much better treatments for patients that have peripheral arterial disease, which is really disease getting blood to the body.
And so before we get into the treatments and all of that, let's just start off with what is peripheral arterial disease. And maybe we can relate that to something that our audience has heard a lot more about or a condition that they know more about.
Yes, so peripheral arterial disease is a buildup of plaque in the arteries. So as we age, our arteries kind of clog up like the pipes in your sink. And they can get to a point where there's a complete blockage or where the blood flow is so slow that it can't get the oxygen to the tissues, to the muscles, and feed them and let them do their work adequately. And one condition that everybody knows about where this happens is when the arteries going to the heart get blocked and a patient has a heart attack.
So like a heart attack and also like a stroke. So if you don't get enough perfusion, enough blood to your brain, that's when you could suffer from a stroke. Is that right?
Exactly.
Okay, so how could this condition affect peripherally? So that means our legs.
Yes, so the disease affects our legs in a very well-defined pattern. Patients will start with some pain when they walk, and different from vein disease, it's not a pain they can push through or a pain that comes after they're done walking or exercising. It's a pain that as they walk, they actually get so bad they have to stop. And my patients will tell me, I walk a block, a half a block, 2 blocks, and then I have to stop and sit down and rest and wait until my legs feel like I can walk again. Typically, it starts in the calves. That's the most common spot. And then this will progress to having pain when you're just lying in bed. Now, different from cramps, which are common with venous disease, this is pain that happens during the night, can wake you up. And most of my patients will tell me, well, I just kind of sit up and hang my leg over the bed. And the reason patients do that is the gravity helps pull the blood to the muscles, and that will get the oxygen to the tissues and get rid of that pain. Further, this can progress to the point where there's difficulty healing, and patients can just have skin start to die without any injury or anything like that. And this is the last stage of disease, and it's also the most serious stage, and this is called critical limb ischemia, where the blood is just not getting to the tissue and the tissue is just dying.
And I will add to that, of the 8 million cases each year in the U.S., 20% of those lead to the dreaded complication of amputation. So before we get all the way down to that road, let's start from the very beginning. If a patient comes to us and they have difficulty just walking to the mailbox or walking up a flight of stairs, what is kind of the first line therapy that we go for?
So the first line therapy that we'll use, if their primary care physician hasn't used it already, is diet adjustments, exercise, mainly lifestyle changes. Quit smoking is very important, as is getting your diabetes under control. Most probably 90 to 95% of patients that have significant peripheral arterial disease also have type 2 diabetes. And they kind of go hand in hand. So if we can adjust those factors and lifestyle and get patients just to be healthier, a lot of times we can kind of overcome, any progression of the disease.
And say that our patient tries diet and exercise or has difficulty adhering to diet and exercise regimen, and the disease continues to progress onward. Is this a big surgery that we're talking about here, or what services do we offer at Alate Health to help with this condition?
So at Alate Health, we offer the newest treatments. And years ago, the rule of thumb or the mantra used to be only 1 out of 5 patients will ever lose a limb and, end up at that point. And when we only had big surgeries to treat it, we kind of just watched these patients and tried to figure out who would progress. Now, and at Alate Health, this is the case, we can treat this disease from the inside. And unlike surgery, which has a limited number of times you can do it, you have to go into the operating room, you have to have anesthesia, and these patients that have disease in the arteries in their legs tend to have disease in the arteries, in the heart, in the brain, other areas. So that's a high risk endeavor to undergo the anesthesia. When we treat the disease from the inside of the blood vessel or endovascularly, there's pretty much not a limit as to how many times we can do that. So it's a much safer, much more repeatable, and much better tolerated treatment for the patients. Again, as is everything in Alate Health, it's an outpatient procedure. Patients come in early in the morning, we do the procedure, they leave by early afternoon, and they're able to walk in and out of the office, and they do very well after treatments.
So endovascularly, once you're in the vessel, and I will add that we start this procedure like we do all of our other minimally invasive procedures by placing an IV into the artery of the groin. And through that IV, the entire procedure is performed. What tools and technology do we have to aid us in revascularizing these limbs?
So everyone kind of knows what a stent is, or a piece of hose that holds the blood vessel open. At Alate Health, we rarely use those because they have their own sets of problems. We like to use newer techniques, which are things like atherectomy. And what that is a fancy word for saying a roto-rooter, or cutting the plaque out. And these devices are very small, very safe. They cut just a tiny fraction of the plaque out with each pass, and it actually collects the plaque as we cut it out. We also have new age balloons. Patients in the past for years were treated with these balloon angioplasty, where the balloon would inflate in the vessel and kind of smush the plaque and open it back up. Well, now we have new balloons that actually have medicines on them that will go into the plaque and treat the artery, and they actually can last there for up to 6 months. And these have been a huge improvement in the way we treat vascular disease and the way we treat it endovascularly.
So there's 2 ways that we can open up these vessels. So we can kind of shave off the plaque, the fat, all that buildup. And we can also open up the vessels with these balloons. So once we're finished with the patient, one of my favorite things to do is to show them before and after pictures. A lot of these cases that come to us, there's barely a trickle of blood flow going down to those feet. And then when we're done, lots of blood flow, everything is open. I bet those vessels look better than mine. So what do we tell our patients? Do they have a brand new lease on life and they could just go right back to what they were doing?
Unfortunately, no. After we intervene, it's even more important that they adjust their lifestyle, that they take their medications regularly, that they get their weight under control, they get their diabetes, their high blood pressure, all those things under control, and start living a healthier lifestyle, because it will come back, and it can actually come back faster if they don't do any lifestyle adjustments.
So a lot of these symptoms that you're telling me, they can kind of be blurred with venous symptoms. So do we oftentimes see patients that come in with a mixed picture?
Absolutely. Especially patients who come in with any kind of healing issue, you have to evaluate and you have to evaluate very thoroughly for both diseases. And you may see around town, this vein center, that vein center. Well, when you go to a vein center, it has to be venous disease because they don't treat the other side of the circulation. At Alate Health, we offer 100% complete screening of vascular disease, whether it be venous or arterial, and we can offer treatments for both conditions, which I think is very unique. And patients will get the best treatment, the most state-of-the-art, most technologically advanced, and the safest for their condition.
So treating the whole patient is one of the many things that we strive for here at Alate Health. So we have to take a quick break, and when we get back, we're going to give you more information about peripheral arterial disease.
So make sure you stay with us for another episode of Alate Health Presents after a short break.
During the Cadillac Season's Best Sales event, Ron Carter Cadillac, Houston's only Cadillac to-your-door dealer, delivers 0% APR for 72 months, plus $3,000 bonus cash on both the first-ever 2020 CT4 Luxury Collection for only $449 a month, and the first-ever 2020 CT5 Luxury Collection for just $499 a month, both with only $1 down. Gulf Freeway, just 2 minutes south of the Beltway.
Shop smarter when you shop Ron Carter. Ron Carter, Cadillac.com.
Have you been injured in an 18-wheeler accident, truck accident, car accident? Was someone texting and ran into the back of you, not paying attention? It doesn't matter what it is. Give me a call, Attorney Willie Powles. We'll fix it today. The number is 281-881-2457. Again, that number is 281-881-2457. We'll fix it today. Call Attorney Willie Powles.
During the season's best sales event, Ron Carter Cadillac delivers 0% APR for 72 months, plus $2,500 bonus cash on all 2020 XT4, XT5, and XT6. Or drive 2020 XT4 Luxury Collection, only $299 a month. 2020 XT5 Premium Luxury Collection, just $369 a month. And first ever 2020 XT6 Premium Luxury Collection, just $399 a month. All for 39-month lease with just $1 down.
Ron Carter, Cadillac.com.
I'm Attorney Willie Powles. Allow me to express myself with you. If you've been hurt or injured in a car or truck accident, give me a call and we'll get it fixed today.
And we're back. Today we're talking about peripheral arterial disease, a disease that affects 8 million Americans every year. Dr. Doe, is there a special subset of the population that is affected more?
Yes, so as we said before, certain medical conditions kind of increase your risk or increase the progression of peripheral arterial disease. And those things are, number one, diabetes, number two, obesity, number three, age, and then other medical conditions such as high blood pressure, high cholesterol. Those things can all lead to a faster progression, and it's very important that patients talk to their mothers, fathers, aunts, uncles, grandparents, and see if there's been any of this type of disease, or especially patients that have heart attacks at very young ages. They have a much higher risk of having peripheral arterial disease.
And is there a gender predominance?
Yes, so it's slightly gender predominant for men over women. And this is because men don't have estrogen, which is actually protecting women against peripheral arterial disease. And women, 5 years after menopause, though, they will actually have the same risk for peripheral arterial disease as men. So as we talked about when we discussed treating fibroids, you want to avoid that hysterectomy, that total hysterectomy, because you want to keep the ovaries, you want to keep the estrogen as long as you possibly can, because it gives you a protective benefit, especially against arterial disease.
So we talked a little bit before the break about how we perform this procedure, endovascularly and completely minimally invasive. After the procedure, though, what is the recovery like?
So you will stay in the office for about an hour after, laying flat for about an hour after the procedure. Then we'll sit you up. We'll be monitoring your vital signs, the puncture site, and then if everything goes well, usually about 2 hours after the procedure, we'll have you get up and walk. If everything looks good, then you'll actually be discharged to home. You'll have some limitations for the next 3 days. We don't want you to lift anything heavy because of the puncture in your groin, but we'll also have you, kind of take it easy, but we want you to walk. We want you to get out there and be moving and keep the blood flowing in your legs. And then, of course, we want you to be adjusting your lifestyle, not smoking, taking your medications as prescribed, and being more active in general.
So the effects of the revascularization, we're now sending a whole bunch of blood down to the lower extremity that was kind of starved of blood prior. Is there any repercussions for that?
Yeah, sometimes patients will say they have like an achy pain, almost like a venous pain, or they'll say they feel, kind of tingling in these areas, just weird sensations, and that's what it's from. All these tissues, when they don't get enough oxygen, they'll kind of shut down over the course of an extended period of time. And then all of a sudden you get this oxygen back to them and they have to kind of wake up. And when they wake up, it can actually be a little bit uncomfortable for the patients. But we'll tell them what are the bad signs to look for, and then what are the symptoms that they can just call us about and probably aren't as important to really rush in for treatment. And typically those are things that can be controlled with some over-the-counter anti-inflammatories. So
for our referring physicians, is there anything that they need to send the patient with, any lab work before they come to us?
Typically these patients, because they'll have other medical conditions, will have some recent blood work. But as far as the workup goes, anything that we need concerning peripheral arterial disease, we can actually take care of ourselves. They simply need to just send the patient and say, this patient has leg pain. And like I said before, at Alate Health, we can treat and work up issues with all sides of the circulation. So leg pain is good enough. We'll determine whether or not we think it's more venous or more arterial, and then we'll do the appropriate workup.
Sounds like a one-stop shop. So do you have a certain imaging modality that we gear towards? Do we prefer CTAs? What is a CTA? An arterial Doppler? What are those things, and how do they help us in our investigating?
So the best things you can do is listen to the patient, and if the history isn't completely clear, we'll probably progress to an arterial ultrasound. And if that's not completely clear, then the highest level that will go is the CTA, or the CAT scan angiogram. And that's a specialized CAT scan that will see the dye running through the arteries and show us kind of the best picture we can get without actually becoming invasive and going inside the arteries. But we usually reserve this for patients when it's just not clear, but we're very suspicious, which is a small percentage of the case. Usually with the history and the ultrasound, we can pretty much determine who needs to be treated.
And in terms of following up and timeline, once we perform the procedure, how early do we see our patients back?
So if it's a patient with a wound or a healing issue, then we'll see them back for wound checks, usually at a few weeks. Typical patients who might have just pain at night or pain with walking, we usually have them come back to see us at a month, 3 months, 6 months, and then a year, as long as the symptoms don't get worse.
Do we work with other facilities if a patient already has a wound, or do we just try to manage it all on our own here?
We can do both. Some of the new wound treatments we'll be offering at Alate Health are specialized patches that have some fetal or newborn growth factors in them that help the healing progress. Now, if it's a large wound or if looks like there's a chance that it's infected, then we'll typically get them to a wound care center so they can kind of manage that.
So that's great that we're able to treat, just crampy leg pain, claudication, all the way to, probably the end stages of when someone has an ulcer. So anywhere between those two, it sounds like we're able to help in some way.
Yes, we are, but as we tell the patients, as we tell everyone, we don't want the patients to come in, if we can avoid it, with that big wound, because those are the most difficult cases to treat. They're usually the oldest patients, the furthest along, with all the other diseases kind of present that you have to adjust in order to get these patients to do well. So typically, patients will have some level of disease that we can actually screen for much earlier. So any patient who is under 50 with diabetes and high blood pressure, especially if they're obese, they should get screened. Any male with high blood pressure over the age of 50 should be screened. And any woman 5 years after menopause should be screened, and especially if they have diabetes. Doesn't really have to wait until they're 5 years postmenopausal. That diabetes and obesity, high blood pressure, all those other things can get you to the point where you probably need to be screened, because the earlier we catch these diseases, the easier it is to treat the patients.
That was a long list of patients that, need to be screened. And so I feel like there's a lot of the population that's either not so sure about this disease or they're not sure what can be done about it. So take advantage of the holidays, you guys. If you see an aunt and uncle, your grandmother, grandfather having difficulty walking, complaining about achy legs, it's time to catch this, and it's time to catch it soon. So if you want to make an appointment with Dr. Doe or myself here at Alate Health, tell them how they can reach us, Dr. Doe.
So they can always visit our website, alatehealth.com. They can call our main office at 713-955-1707. And we're going to December 15th, where we'll be opening our second location. That will be on 45 South and Highway 8. That's going to be 12825 Gulf Freeway. And that's Houston, Texas, 77034, if you're going to look that up on the Google Maps or whatever it may be. So, and one thing, Dr. Maneevese, that I like to tell patients is the key to a long life. All of my oldest patients are my walkers. And anything, whether it be venous disease or arterial disease, if the patient can't walk, then their quality of life goes way down. Their weight goes up, their chances for or their ability to control their diabetes gets lower and lower. So all of these risk factors increase if a patient can't walk and can't be active and can't exercise. So as I founded Alate Health, it was really from the vascular disease side, was to get patients to where they can walk, and they can walk without pain or without any issue.
Saving limbs, saving lives, just one of the many things that we offer here at Alate Health. And Dr. Doe, one more time, what is happening on December 15th?
So December 15th, we'll be opening a second location serving Southeast Houston, and we will offer the full range of treatments, whether it be uterine fibroid embolization, prostatic artery embolization, treatment for venous and peripheral artery disease. So you can make the appointments, again, by visiting alatehealth.com or by calling at 713-955-1707. And we look forward to getting our patients back to their normal lives and enjoying it.
That's all the time we have today on another episode of Alate Health Presents. We'll see you next time.